Hey everyone, Sgt Rians here. And today I've got a special presentation for you. I actually received an email from one of my old military buddies, and he was explaining to me the hip pain and hip problems that he's had for the past few months now. And he doesn't know what to do. He's looking into surgery, and pretty much what I told him was to, wait off on that. I'd make him a video on exactly what to do to rehab his hip, because a lot of you may not know that last year, actually around this time, I was in a wheelchair. I was in a wheelchair for 3 months. The reason I was in a wheelchair was because I actually popped my left hip out of place. Didn't realize it, and it was painful, but it sat out of place for so long that the tendons and ligaments actually stretched out, and they would no longer hold my hip and joint. So the routine that we're actually going to go through today is the routine that I did almost every day to rehab my hip, and now I'm back to normal. So let's jump right in to this hip therapy video. And we're going to start with our lying adductors first. So with this exercise here, all we're going to be doing, lying in a comfortable position, laying on one hip. I'm actually going to rock forward a little bit onto this hip, and we're actually going to be lifting the right leg first. So with this exercise, try not to point. I don't want your toe pointed straight forward. I actually want your toe pointed slightly down at a 45-degree angle, which is going to work a little bit further back on that hip and back into the glute area. So with that there, your hands can be out in front. All we're going to be doing is lifting about halfway down, lifting back up. When you're coming up, again, focus on that squeeze in that glute and that outer thigh area. Okay, squeezing up and down. Now, if you're doing this one, let's try to do this one for time. So you're going to get each side for 30 seconds, okay, then relax. All you're going to do, flip to the other side. Same exact thing, making sure that left toe is angled down about 45 degrees. So 30 seconds on one side, 30 seconds on the other, and then you're going to be going straight into your bridge. So with your bridge, lying flat on your back, feet are flat on the floor. Now, with this exercise here, all we're going to be doing is lifting those hips up in the air, making sure, squeezing those hamstrings, squeeze those glutes, make sure everything stays tight. So, now you can do this for time and hold this for 30 seconds, or you can drop down. Do not set your hips all the way back down on the floor. Right before they're going to hit the floor, stop, and then go ahead and come back up, flexing, again, those hamstrings and glutes, right back down. Squeezing, right back down. Now, with that there, let's do another 30 seconds of either holding or going through those squeezes. Just matters on, for therapy-wise, if your hip's really bad, or if it was anything like mine, just going up and holding that position was actually very difficult to do. But again, play around with both of them. Do the hold for 30 seconds. The next day, try to do the pulsing, getting that good squeeze, see which one feels better for you. From there, you're going on to glute squeeze. So you're staying in position. All you pretty much do from here, put your legs out, and all we're going to do is focus on flexing those glutes and relaxing. Flexing those glutes, relaxing. Pretty simple exercise to do. Just keep those legs out flat, flex the glutes, and relax. Again, let's do the glute squeeze, okay, 30 seconds on, okay, then relax. From there, we're going on to the clams. Now, this one here, we're going to lay on our sides, get our feet in a triangle shape here, and again, find a good comfortable position for you. Now, from here, all we're doing is lifting that right side up as far as we can go, right back down. Lift it up, right back down. Now, I do not want to see a bunch of excessive movement here. Don't rotate those hips back. Those hips should stay solid right here. This leg stays on the ground, does not pop off the ground. And all we're doing is bringing that right knee up, feeling that good contraction in that hip joint, right back down to tap, and coming back up. Now with my foot, I'm going to make sure my right foot stays right on top of my left. I'm not bringing it off. Stays right on top, right back down and up. All right, so with the clam, 30 seconds on your right side. Immediately go over to your left side. Give me 30 more seconds on the left side. And then we're going into the lying adduction. With your lying adduction, you're going to need something. Now, you can use, I'm going to use a foam roller to put in between my knees, but you could use a medicine ball. You could use a pillow folded up, anything that's going to cause, that you can press against with your knees, that's going to hold your knees out in place. Now, with this exercise here, all we're going to do is make sure our feet are together on this. And with your pillow, with whatever you may have, you're going to put in between your knees. All right, so from here, all I'm going to do is lay back, and I'm going to flex, relax. So all I'm doing is squeezing my knees together, trying to crush this foam roller, and then relax. You're going to feel that flex in the inner part of your legs here. So flex and relax. Flex and relax. Now, with this exercise, you can do the flex and relax, or for that 30 seconds, you can squeeze and hold for 30 seconds. Again, play around with this, see which one works best for you. Alternate back and forth on each day. Either way, just play around with it, see what works for you. And again, you can use a medicine ball. You can use a folded up pillow, just as long as your knees aren't coming all the way together. We need to keep a little bit of separation in them, squeezing, relax, or squeeze and hold. From there, the single hip lift. If your hip is really bad, I would skip the single hip lift. This one's a little bit more difficult, but if you can do this one, that's why I put it at the very end. If you can handle this one, I would suggest doing it. When my hip was really bad, I could not do this one at all. There's no way I could lift, especially with my left leg. There's no way I could lift up in the air just because my hip joint was not in place. So with that single hip lift, again, you're going to be laying down on your back. I'm going to actually do it with my left side here. You're going to keep that right leg or the opposite leg up in the air. All we're going to do is hands down flat, drive this hip up in the air, right back down. If you need to go all the way back down, that's fine. Come right back up. If you can do it where you come down, almost hit the floor, then back up. Almost tapping the floor, drive back up. Making sure that the leg that's down, you're driving through your heel to get those hips up in the air. Again, you're going to do 30 seconds on one side, 30 seconds on the other. Now again, if you can do that, great. If your hip is really bad or if your back's really bad, then don't do it and skip it. And then we're just going to go straight into the stretches. All right, so first stretch is your hamstring stretch. Real basic. All I want you doing is running this off the ground. So one leg up. All we're going to do is extend this leg and pull it back towards you. Relax your head down. Okay, pull this back. If you have a towel or something else that you'd like to wrap around your foot, great. If not, lock that leg out and gently pull it towards you and get that good hamstring stretch. Now again, you're going to hold this for 30 seconds, then relax it. Now with your stretches, you have to hold for at least 30 seconds. If you do not hold for 30 seconds, you're not going to give your muscle enough time to relax and actually get a good stretch. So you can go over 30 seconds, it's fine, but you at least have to get 30 seconds on that stretch. So 30 seconds or more on that side, switch over to the other side, pull that back, get that good hamstring stretch. Everything else is relaxed. Nice, good stretch. Again, holding for 30 seconds or more, and then relaxing. From there, we're going to go into our figure 4 stretch or your piriformis stretch, whatever you like to call it. Most people can remember figure 4 a little bit better than piriformis. So let's start off. What we're going to do with that left side, left leg, we're going to kick it up and put it right over that right knee. Now, from here, a lot of people lift this leg up and reach through and pull and hold position. That's fine, okay? As long as I don't want you flexing this right leg. I want it relaxed, okay? And look, what we're looking for is getting that stretch right in those glute muscles and piriformis muscle. If this knee really pulls in, if your hips real tight, then what I would like to see is you reach right over your leg here. Do not grab onto your foot. We don't want to incorporate in two joints into the stretch, so grip above your ankle joint, and then you're actually going to push this knee away to make sure that it doesn't cave in this way, and then pull that leg down towards you. You can also wrap around this knee and pull that leg in towards you as well. All that's fine. Again, you have to feel for which way of doing the stretch is going to best hit that area that's tight. And again, holding this position nice and relaxed, not flexing and pushing into that stretch. Again, it's a stretch, it's not an exercise. So just relax, pull that in towards you, make sure you feel the stretch, hold for 30 seconds or a little longer, and then you're going to be switching over to the other side. So other side, left leg's down, right leg's over. Good position here. And again, you can lift this leg up, keep it relaxed, and use your arms to pull it towards you. Or gripping above the ankle, pushing that knee away and pulling towards you here. Or reaching around that knee and again, pulling that leg in towards you. So whichever way feels best for you, then definitely do it that way. Now, if there's anybody else out there that has any other rehab questions, any other workout questions, again, feel free, go to our website, www.FitRanX.com. You can shoot us an email. You can shoot us an email from our YouTube channel. Either way, I'm going to get it, and I will definitely make a video for you, addressing whatever issues you may have. So, we'll see you next time.